Welcome, everyone. Thank you for joining us today. First and most important, we want to wish everyone good health. Hope you and your families are staying safe during this time. We appreciate that you're taking the time to be with us today. This is the third webinar in our 5-part series. This week and next week, our focus will solely be on the test criteria. If you'll go to the next slide, we're going to deep dive today into the revised ONC test criteria. Next Tuesday, we're going to talk in depth on the new criteria. And then the last webinar in the series will wrap up by talking about the conditions of certification and surveillance. There's a link here to register, and it's also live on our website and resources pages. Another thing to note is that we're going to start a weekly blog post to break down the 21st century cures and to give updates on the program. More on that to come for signing up to those updates. We'll send that information and the instructions in the follow-up email with the link to this recording. I'm your host, Melissa Martin, and I have with me several panelists today. First, Timothy Bennett. He's our test lab director who runs our test lab. He, along with others at Drummond, meet with ONC weekly to get clarifications on the rule as well as discussing the future of the program. We have two of our account managers and test proctors on today, Heather Kelty and James Threet. Heather's our main speaker today to talk about the revised criteria. She provides a lot of the test support and resources to our developers, and she's been working in health and IT for the past 14 years. Answering the questions live during the webinar, I have James Threet. He's been working in the healthcare industry for the past 17 years, and he's going to present next week on the new criteria. So we're going to do this Q&A so you can ask questions live during the webinar, and he'll either mark those for later to discuss at the very end, or he'll answer them live. And then we'll do, so any of the questions that you have for the presentation, please submit those and James will get to them, or we'll get to them at the very end. And if we don't get to your question today during this presentation, don't worry, we'll get back to you via email. And we're also doing polls today, and I'll let Timothy speak to that in a moment. And again, this is being recorded, so don't worry if you missed something. We understand there's a lot of information to soak in, and we're going to send it to you via email, and it'll be posted to our website. So I'm going to go ahead and let us get started and hand it off to you, Timothy.
Thanks, Melissa. I really appreciate that. And let me just echo, Melissa's welcome message to everyone too. I was just perusing a few minutes ago of the attendee list, and just so many familiar names, popped out. People I've worked with, you folks for a long time, and it's just really good to see, so many familiar folks coming back and, attending today. And, we hope to do you proud with information that we shared today, and we're definitely looking forward to your questions. So don't be shy about getting James, putting him to work during the call. He's not going to talk today, except maybe at the end a little bit. But let's make sure he works for his pay today. We're looking forward to those questions. I will, mention about the polls that Melissa talked about. It's always our heart at Drummond Group to just make sure that we understand how best, to serve you and help you towards, your goals of getting certified or maintaining your certification. And so, to that end, we've put together a handful of poll questions that are designed to try to help us get a feel and a landscape of, where you folks are in your journey along with, with the new rule from ONC. So we certainly hope that you will participate in the polls, and we'll try not to, make them too onerous for you to, participate in. But I want to thank you ahead of time, for any information that you give us, and, hopefully we'll be able to use that to, inform our support moving forward of how to help you best. So the first, question I want to kind of hit here is because, we actually get this quite a bit, is who does the cures update rule apply to, from ONC? And just want to make it very clear that all of this new and revised criteria that's in the cures final rule, it applies to all 2015 edition certified products. And by that, I mean, if you already have a product that's certified to the 2015 edition, you will have to meet these updated requirements, mostly within the next 24 months, in order to maintain your 2015 edition certification. Now, we'll get into a little bit shortly in another slide. There's going to be some distinctions on the chapel between, the chapel listings now and what the updating ones will look like. But this applies to everyone who has a certified product. And of course, it kind of goes without saying, if you happen to be here and you haven't certified your product yet to the 2015 edition, you don't have to do the 2015 edition first and then do the cures update. You can go straight to the superseded requirements that the cures rule brings out. So hopefully that helps clears up just some basic questions around it. Heather, if you don't mind, you can go to the next slide.
Yeah, Timothy, I think you wanted to do a poll question, right?
Oh, I did want to do a poll question, right? I mean, I just talked about a poll question and then didn't do that. So let's do that. Thanks for reminding me,
Sure.
Heather. So Melissa's brought up the first poll question, and we just want to kind of get a quick survey of just how you feel, your gut feel of how you feel about your organization going into addressing these updates from the cures rule, and just how prepared you might feel, what kind of general help you might need, just some big bucket categories here, just to give us an idea. And we'll just keep that poll up for just a couple of more moments to give you a chance to respond. While you're doing that, I'll go ahead and just kind of talk a little bit about the ONC's enforcement discretion timeframes. So they recently announced some flexibility in the timeline of compliance to the deadlines that are specified in the cures rule. Basically, and this is all due to the impact of the COVID-19 pandemic and how that may be affecting the industry. Basically, what they're doing is they're allowing an extra 3 months window to come in compliance with each of the deadlines as they approach in the timeline. So they're not, and it's important to understand this, they're not pushing the deadlines out. The deadlines are still what they are. So, for instance, the deadline for having your real-world test plan is still this December 15th, uploaded to the chapel. That's still the deadline. However, they are giving the ACBs a flexibility of 3 months before they begin to enforce noncompliances. All right, so you will have, for all of these deadlines, you'll have that extra 3 months, before the ACBs will have to, enforce noncompliances. And you can look at the chart there, but these are the ones that kind of pertain to the revised criteria. The USCDI and the APIs is a new criteria, and then the data export. So these are some of the big three main criteria changes, and those are the compliance timeframes that's set forth in the rule, including the 3 month extra window. So next slide, please, Heather. And before we sort of get into the deep dive on the criteria, I just want to kind of take a moment to just establish a few working terms that ONC uses and some key dates to remember before we have our second poll. So when ONC talks about the publication date of the rule in the rule itself, or in any of their corollary documents that they hand out, we now know, because the rule has finally been published on May 1st to the Federal Register. So the publication date of the rule is now locked in at May 1st, and that starts the time ticking on just about all the other deadlines. The first deadline, or the first time post, is what is referred to as the effective date of the rule, and that's 60 days post publication date, and we now know that to be June 30th. So the final rule will now be effective on June 30th. So that's when we can start, everyone can start doing things from a testing and certification standpoint, with the new rule, and when, the very first actions that ONC will begin to take with the rule. And we'll get into those in a few moments. So during these first 24 months, so 2 years from I think it's from the publication date, actually, the first 24 months, they're actually probably the effective date for this, because they won't be making any kind of chapel changes until the effective date of the rule. So for these first 2 years, starting June 30th, there will coexist two different certification distinctions on the chapel. The current 2015 edition certification, the way it is right now, but then you will see what they're going to call a 2015 edition Cures Update certification. And so over the course of the 24 months, you guys will be, updating your products, and ultimately the goal is to switch over to the 2015 edition Cures Update on your chapel listings. And, at the end of that 24 months, the current 2015 edition certificates will, they'll no longer be a thing. That's the goal, is to get everyone pushed over. Now, the only exception to this 24 months sort of rule is the new B10 EHI export criteria, which we'll talk about a little bit in depth in next week's webinar. But it does have a 36-month or a 3-year window to when those of you that are required to certify, test and certify B10, you'll have that extra time. So you can be 2015 editions Cures Update compliant within 24 months, but then you'll have an extra year if B10 applies to you to get that extra criteria tested and certified, or then you'll be in jeopardy of losing your Cures Update certification, or being non-compliant, I guess is a better way to put it. All right, well, enough of that. Let me get to our last poll, or our next poll, rather, not the last one. So this one, we're just trying to get a survey here of when you guys are kind of a gut level feel of when you're thinking you might be ready to begin certification and or testing activities towards this new and revised criteria. Is that going to be this year? Is it going to be something you're thinking is a next year activity, or something beyond that? And of course, if you don't know, that's fine too. Just let us know, and we'll keep that poll up for a short time. And while we're doing that, I'm going to go ahead and introduce Heather Kelty. Melissa mentioned at the beginning that she's one of my colleagues. Heather is an account manager, test proctor. Many of you are already working with her, and she's going to do the deep dive and let you guys all know, all the things you need to know about the revised criteria. So, Heather, just take it away, and we'll come back at the end and probably answer some questions from the field.
Great. Thank you so much, Timothy. As part of the Cures Act, there were some criteria that will be removed pretty quickly, and some that will be removed after a certain time. So I wanted to make sure that you guys were aware of what those were. So the criteria being removed is really date driven. So I'll be covering important information related to the milestones from your June 30th, 2020 timeframe all the way through to the April 30th, 2023 timeframe. So let's start with our June 30th, 2020 timeframe. On this date, developers will no longer be allowed to certify to the removed criteria, and they will be marked as removed on the chapel listing. So this includes the A6 through A8, A11, and B4 through B5. Developers will be able to start testing and certifying to new criteria which we'll be exploring in our next week's webinar. And this includes the B10, D12, and D13, and G10 as well. Developers can also start to actually certify to the revised criteria. And there's quite a few more of those. So that will include your B1 through B3, your B7 through B9, which is still optional, your C3, D2 and D10, your D3, E1, G6, and G9. Note that this date will also be the retirement of the 2014 edition chapel listings. So they'll retire these listings as they did such for the 2011. They'll still be listed on the website, but they'll be in a retirement status. For products that aren't certified to the 2015 edition yet, but you would like to inherit GAP some of your eligible criteria, you would need to do so by the June 30th date also. Otherwise, these criteria would need to be self-declared. You will no longer be able to GAP eligible your criteria after this June 30th. So if this applies to you or you're interested and would like some more information, please make sure to reach out to us account managers for some next steps if you have any interest in making sure that you GAP inherit that criteria. So let's jump into January 1st, 2022. There's not a whole lot going on here, but we just wanted to make sure that you're aware that developers will no longer be able to certify for the A10, A13, and E2. These will also be removed from the chapel. These criteria are really being removed so they can align with the CMS reporting program. So April 30th, 2022. Some things to note here. As a developer, you will no longer be allowed to certify for the G8 criteria. Now, within this 24-month window, testing and certification to the new G10 criteria will actually replace the G8 criteria. Otherwise, G8 will just be marked as removed on all the chapel listings after that 24-month window. This date also marks for developers to be able to certify to most of the new criteria, and that includes your D12, D13, and G10 criteria. And at this point, you guys must all be updated to all the revised criteria and standards. Although, as Tim mentioned earlier, there is one exception here for the new criteria, and that is B10, which is not required at the 24 months. So April 30th, 2023. The most notable thing here is you no longer be allowed to certify to B6. It also has that same 20-month window time frame where it will then be replaced by B10. Otherwise, it will just be removed, marked as removed on the chapel listing. And if applicable, as a developer, you must certify to the B10 criteria in order to maintain your 2015 Cures Update certification. So that's a big thing to note for that. So let's have a deeper look into some of these changes. We will be looking in detail to the revised criteria for your interoperability pieces, privacy and security tags, clinical quality measures, and electronic prescribing. And I think we wanted to take a moment here and get your feedback on a poll question that we had in mind. So we want to know which one of these revised criteria is your organization most ready to test and certify. And of course, it's multiple choice, so please be able to choose the different options that we're ready to test. We just want to know from our standpoint, is it really just the USCDI, that the ERX? Are you ready to test all of them? Or you're really not sure at this point, you're kind of still getting through the final rule and getting a grasp on those types of things. So while you answer that, I'm going to go ahead and jump in to the slides. First, we'll be taking a look at the changes that are related to the interoperability criteria. So let's take a minute to review some of the main points for the USCDI. It will be replacing the current Common Clinical Data Set, or what we commonly refer to as CCDS, with an addition of 4 new data elements. It will be updated with the CCDA Companion Guide. The ONC will follow a transparent and collaborative process to really expand the USCDI, and this also includes using stakeholder comments. It's actually going to follow the standard version advancement process, which allows you guys as health IT developers to update to newer versions of the USCDI. And we really will be taking a deeper dive into this in our upcoming webinar when we discuss the new criteria next week. So the changes apply really to your B1 and your B2, E1, F5, G6, and G9 for the USCDI. The compliance date for this would be your May 1st, 2022. Keep in mind that health IT modules will need to comply with your information blocking and your real-world testing for the 11/1/2020 date. So we anticipate that to be compliant for these, the system will need to comply with the limited EHI scope, which really includes your current CCDS elements. The additional 4 new fields will need to be compliant at the May 1st, 2022 date. And if you watch our webinar on the certification and compliance that we have upcoming, there'll be some additional information given for those there as well. So the 4 new required classes and data elements are your provenance, your clinical notes, some pediatric vital signs, address, email, and phone number. I'm going to take a minute to jump into the full USCDI list. So as you can see in the full guide, a lot of what you're seeing here that's part of the USCDI is really a carryover from the CCDS. So you're going to have your goals, health concerns, immunizations, laboratory, and such. So let's dive into a little bit of this. For the vital signs, you're going to notice that there's now weight for length, and there's also head circumference for children. You have your provenance, which is your timestamp. It's also going to give you an author organization, which we think will really be on the data class level. And then you also have some of your demographic changes as well. And I did provide this link, so once the presentation goes out, you will be able to kind of take a look at this if you haven't already, just to get some reassurance that, you know, a lot of what is here, EHR companies are already kind of doing. And then also, if you're certified to the B9 or the care plan criteria, there are updated templates for compliance with the Cures Act within the CCDA Companion Guide. Just a little note that's extra for that B9 criteria. So some important things to consider. If you're already certified to the 2015 edition, you will need to utilize Drummond's attestation process to notify the ACB that you have implemented the changes for the criteria. For this one, this also includes USCDI compliance in your real-world testing plans that will need to be submitted with that limited EHI scope that we just spoke about. If you're not already certified to the 2015 edition, you will need to follow our normal process of testing and certification. You will not be able to use this attestation option for compliance. So next, I kind of want to just discuss the requirements for D2, D10, and D3, which is our privacy and security framework criteria. So the main change here is the update to the new ASTM E2147 standard. And I did list some of the sections that are required as part of this standard. I will note that we expect that the ONC will actually clarify some things with the new duration of access requirement in that new standard, whether it's going to be applicable to the ONC certification. I know it's a big question for everybody, and we're hoping to get some clarification on that soon, because I know that that will kind of determine some of your development routes. And then you guys are also required to provide updates to customers by that May 1st, 2022 date to comply with the maintenance of certification requirements for the real world testing, condition of certification. So keep that in mind as well. So let's jump into security tags, which is your B7 and your B8. So this criteria is formally known as the Data Segmentation for Privacy for the DS4P. And it was renamed to Security Tags Summary of Care for both your sending and receiving. So the biggest change here is the additional tagging. Currently, privacy is marked at the document level. It will now be able to be marked at the document level, the section level, and the entry level. So this really allows for some flexibility to address more complex use cases and privacy preferences for patients as well. So again, some important things to consider for these criteria as well. If you are already certified for the 2015 edition for B7 and B8, you will need to utilize, again, Drummond's attestation process to notify us that you've updated to support this new security tagging and the requirements surrounding that. If you're not already certified to the 2015 edition, you need to follow our normal process of testing and certification. You will not, again, be able to use that attestation for compliance with this particular one. So let's jump in a little bit and discuss some of the changes for the clinical quality measures just for our C3 criteria. So for C3, vendors will actually just need to support the CMS QRDA implementation guide instead of the current HL7 implementation guide. The changes made here by the ONC are really to align with CMS electronic reporting requirements. So for example, as an EH or CAH measures, you're only required to support reporting for the QRDA category 1. If you're supporting the EPEC measures, you're only required to support reporting using the QRDA 3 file. And keep in mind, this does not affect the QRDA reporting requirements for C1 and C2. Those will still remain using the HL7 implementation guide as it does now. And again, your compliance date for this is your July 1st, 2020 date. So a little bit about, there's a new version of Cypress, which is your 5.4.0. And this is really the one that's going to support the Cures Act and the updates related to those. And we anticipate that the planned version for release of this is May 14th of 2020. There are some detailed information that you can find out there on the Cypress website under their Tech Talks. And I did provide a link there. There's some good slide decks and information for their upcoming versions and the calls if you're not already signed up for them. But they do kind of walk through their versions that are upcoming and what's included in those. And I also wanted to make a note here that the update's going to include some enhancements, which is also going to include modifications made to duplicate patient data and making kind of more real world from a testing standpoint and a workflow standpoint. And again, there's a little more information on some of the changes they made there on the Cypress website. And there is another version of Cypress coming out, which is version 6, which they anticipate to be sometime in late July. This isn't explicitly related to the Cures update, but we wanted to make you aware that it is the version that's going to include the 2021 measure support bundle. So if you're looking to kind of start testing on those 2021 bundles, that version 6 is the version that they're going to be putting out that will allow you to do that. And again, if you're already certified for the 2015 edition, we are in the process of confirming with the ONC if compliance for this will be determined by an attestation process or by self-testing like we would do for the B3 criteria. So we hope to have an update for you by next week's webinar when we discuss the new criteria. But otherwise, we will kind of keep you in the loop there as soon as we have some confirmation on what that compliance would look like. If you're not already certified, again, to the 2015 edition, you need to follow our normal process of testing and certification. You can't use any type of attestation process for that. So the last criteria that's revised that I wanted to touch on today is the electronic prescribing, or your B3 criteria. So the requirements for this really include the new script version 201701. And it kind of, again, aligns with the CMS rulemaking on what they had for their e-prescribing guidelines. The test tool also has a draft tool available for internal testing. So if you've already been out on the site, you'll notice that it's been there for quite some time. So you'll be able to go out there, do some internal testing if you haven't already. And then I also created the link there as well. The ONC also has a draft test procedure that's available for B3. Keep in mind, this isn't the final draft of the test tool or the final draft of the procedure, but there's just things that are available to you as vendors that are able to kind of start doing your internal testing. And again, the compliance date for this is your May 1st, 2023 date. So let's take a look at some of the tests that are involved with the B3. So you have your required tests, which you're pretty familiar with if you've already certified, which is your change, your cancel, your renewal, and your medication history. Make a note here that for these required tests, there are 3 new transactions that you will need to comply with, which is status, error, and verify. And there's also, under your optional tests, quite a few different optional tests that you can do, such as denial, RX fill indicator change, get message, resupply, prior authorization, and risk evaluation and mitigation strategy transactions as well. And again, keep in mind that these are all optional tests, but you will see them available under the new script on the test tool. Along with the required and optional, there were some unchanged criteria for the B3 as well. So vendors, you guys will still have to continue to demonstrate the ability to prescribe oral medications only in that metric of milliliter or ml. You still will need to enforce the insertion of leading zeros before the decimal point, and then also allow for trailing zeros after the decimal point when prescribing medications. And of course, as important as it was then as it is now, the transmission of the RX norm codes is also still a requirement. So I just wanted to take a moment to review a screenshot that I had taken from the tool. So as you can see in the top, under the tool scope, it now defaults to the new script. So once you choose that and you load in context-based test cases, you will actually see all of the required and optional cases, test cases as well, listed here, and then you'll be able to drill down into each of them individually. For those of you that are just getting familiar with this tool and haven't already tested with it, please make a note that the test cases are not available or anything on the website until you've actually created login credentials. So you'll want to do that first so that you can see the full scope of all the test cases and everything that you're going to need to know. So wait just a minute. Didn't we already do this and have you attest and send everything? So the answer to that is yes. So you already came to us and did an attestation a while back on all of the certification pieces. So you came and said, I'm using the new script. And yes, you did all that. But that was really just to allow you as developers to meet the CMS 1/1/2020 deadline, and really not to invalidate your current B3 certification criteria for your version 10.6 requirement. So as developers, you still must test your product to the revised B3 to prove compliance to the new script. So you will still need to do that as well. So again, there's so important things to consider, which I kind of just mentioned in your, hold on, wait a minute, we already did this. So just to kind of reiterate that, for the products that are already certified to the 2015 edition with Drummond, there will likely be two options for you guys as developers. The first one is you will be permitted to self-test using the NCPDP testing tool and take all of those validation reports and submit them to the ACB as part of your inherited certification activity. So that's one of your options. The second option is, once the ONC approves SureScripts as an alternative test method, which they're not currently right now, but we expect them to be, you'll be able to take those SureScripts certificates and submit them to our ACB as part of your attestation process, along with that same form for attestation of compliance that you had for your 10.6, that again needs to be signed by both you guys and SureScripts as well. If you're not already certified to the 2015 edition, there will likely be two options for you for certification. The first one is you would follow Drummond's normal process of testing and certification. So you would work with your account manager, you would get your testing set up, and you would walk through the test tool with your account manager in a formal testing process. The other one would be also the same way, which is approving, once the SureScripts is approved, you can use them as an alternative test method. And again, you would be submitting those SureScripts certificates to Drummond, and then you would also be submitting your attestation of compliance form that again needs to be signed by you as a developer and SureScripts. So those would be your two options if you're not already certified. So with that being said, there are some things that we wanted to kind of touch base with you on as far as the EPCS is concerned. So I'm going to go ahead and turn that over to Timothy so that he can kind of walk you through a little bit of information about what's going on there.
Yeah, there's there's always a little bit of confusion about EPCS, e-prescribing of controlled substances, and how that intersects with the ONC rulemaking. And I just want to reiterate that it's really kind of two different rulemaking activities, EPCS and then ONC's e-prescribing B3 criteria. From ONC's perspective, their rulemaking on e-prescribing is sort of agnostic to whatever whether it's a controlled substance or a non-controlled substance that's part of the message packet that goes as far as the e-prescribed message. So their rulemaking really is just to set forth standards and guidance around the general requirements for just doing e-prescribing. It's really in the domain of the DEA to do rulemaking around controlled substances, as I think all of you probably know and understand. But just to reemphasize that, there are some additional EPCS activity in terms of regulations that we just want to kind of mention. We do know that CMS has mandated e-prescribing of controlled substances for writing controlled substances prescriptions for providers. And so all of these controlled substance prescriptions must be electronic by January 1st, 2021. And it was, that was the reason why it was important to get everyone on the 2017-071 script, because it supports things for, better for controlled substances and maintaining where that is, and, some of the other, national emergency, issues around, substance abuse, and things like that. So they've made that mandate, and as a result, DEA's final rule, which has kind of been interim for all of these years, they've kind of reopened it up for comment. And so there's just a lot of recent activity around EPCS, and we just wanted to, make you guys aware of that, especially with all the states also, mandating e-prescribing of controlled substances as well. But to understand that there's two rulemaking organizations in play here. And so just because you get certified to B3, even on the 2017-071, that doesn't mean that in the eyes of DEA, your provider customers are able to just go ahead and be able to e-prescribe controlled substances. There are, things according to the DEA final rule that you have to put into place in order to do that. So let's just go into the next slide here too, Heather, just to kind of continue this conversation. So I'm not sure you guys are aware of this, but Drummond Group, we also do the DEA certifications for EPCS. So we are then authorized by DEA to do these reviews and certifications. Our test plans have been thoroughly vetted by the DEA and approved by them. And so this is a service that we do offer. It's separate from, the test lab and the ACB that you normally work with here at Drummond Group to do your ONC certification, but we do have that as an available service. We do those reviews on both self-developers, those of you who have, implemented your own ERX and EPCS implementation, and also those of you that may have just integrated with a third-party ERX service. So either one of those we can handle. And if you're looking for, a trusted partner to, to help you with that, you can certainly, reach out to your account manager, your test proctor, or, as Melissa just dropped in the chat, there's an email address that you can directly go to, to do that. And to this end, let's bring up another poll. We haven't had one in a little bit, and we just want to get an idea about for those of you who, where do you stand with EPCS? Have you already developed that? Do you need some more information? Have you integrated with a third party, that sort of thing? And so we'll just leave that poll open for a few more minutes. Heather, you want to go into the next slide? So here, as we kind of draw to the end of our prepared presentation and information, before we've tried to save 10, 15 minutes here at the end to do some live answering of questions. Just remind you guys, we got a slide up here for, just some resources and some reminders about where you can get some more information. And just, again, another reminder about our upcoming webinars. And Melissa, let's throw up that last poll question that we have of the day. Now that you've kind of heard all of our presentation here, we'd kind of like to get an idea of if you guys have a feel of how you would like, what your plans when you do get around to doing certification and testing of the new criteria, you know, what may your strategy be? Is it something that you think you might just kind of do all of the required stuff for the Cures update first and then come and get it all done at one time, or in the space of a, you know, short amount of time? Or is this something that you might sort of stagger over, you know, a number of different, you know, dates and milestones? Like, for an example, let's say you may be ready right now because you've already done all the legwork to get yourself ready for 2017-071 for ERX. You're ready to go right out of the gate and get, you know, your B3 test certification update out of the way. And so you might want to do that this year, but then, you know, later on, you might come back and, you know, update your certification later with some more functionality. That's kind of what I'm talking about in terms of, you know, different points in the timeline milestone. And of course, if you're not sure, you know, that's fine too. All right, so I think, you know, as you guys are finishing up your poll, let me jump over here to James, who is, you know, like Heather, another one of our test proctors and account managers. He's been manning the Q&A window from the very beginning. James, do you have some questions from our listeners today that we might be able to answer live?
Sure. Let's start with, what criteria are mandatory to be completed this year for an already certified 2015 edition EHR?
Yeah, that's a good question. So there's really no deadlines this year, other than, I will say, you know, the ones that are later this year, there's two that I know of. And I think Sonia may go into a little bit more in depth on this 2 weeks from now in our last webinar on certification attestations. There is, I think on November 1st is the first info blocking and assurances deadline. And there is something in there related to, you know, the USCDI sort of data. And I think Heather touched upon this just a little bit. ONC is certainly not expecting that you have the new data elements that are above and beyond the common clinical data set. The 4 new ones that USCDI introduces: the provenance. Let's see if I can do this off the top of my head. The provenance, the pediatric vital signs. Let's see, the address and phone number, and there's one more. James, help me out, or Heather. Anyway, there's 4. They're not going to expect you guys to have those ready by the time the info blocking is, but it's related, and you do need to you know, be able to share the data that's part of the common clinical data set, and in order to meet that info blocking requirement for that first assurance. And I would say the other thing this year is your real world testing plan is due. Now, again, all of those will have the 3-month window of compliance added onto it. So technically, you know, you'll have until, you know, first quarter of next year to kind of, you know, meet all of those without being non-compliant. But as far as having to test or certify any of these new or updated criteria, not a requirement for this year.
Yeah, that's the provenance, the clinical notes, the new pediatric vital signs, and and the address, email, and changes as well.
Yep.
Okay, next question. Are you going to share the poll results?
You know, we were hoping, you know, we were thinking, you know, we would, you know, keep those private, you know, because we always value anything that you share with us. You know, I don't know. My guess is no. But I'll take that internally and we'll see what that is. So.
For a new base EHR certification after June 30th, will B6 still be required if the vendor chooses not to certify B10?
Yeah, that's a really good question. So, currently B6 serves kind of two purposes. One, it serves to prove that you're not doing info blocking, and on the other hand, it also is the functional mechanism by which ONC requires that you're able to export data out of patient data out of your system, for various reasons. I think in the Cures update rule, we're kind of seeing that kind of split into two different mechanisms. The info blocking is kind of taken on its own presence in the form of attestation, assurances, and other conditions of conformance, maintenance of conformance and that sort of thing, that you're attesting that you are not engaging in info blocking activities. And then the new B10 criteria will sort of take care of the other thing that B6 does, and that is provide a mechanism to export patient data in a more specific way. I think we'll get into B10 next week as far as its details, but it's a lot more specific than the B6 criteria. But to get back to really answering the question here, I think the big thing that's happening on June 30th of this year, so on the effective date of the rule, June 30th, 2020, is that B6 is going to be removed from the base EHR definition by ONC, and it's also being removed as a requirement for CMS's requirement for participating in their reporting program. So starting on June 30th of this year, for the next reporting periods, providers will not be required to be using certified EHR technology to the B6 criteria. So I would say there, if you're not already certified for B6, while it's still for 24 months will be a criteria that you can certify and test, it's not going away permanently for 24 months. But at least from a CMS perspective, there's probably little incentive to do it, because your info blocking assurances will be handled in another mechanism than B6. So it'll be handled through attestations and other kinds of assurances that you'll have to provide. Hopefully that answers the question.
Okay. The next question, regarding the 2015 edition Cures updates distinction on Chapel, does that mean that ONC will completely separate the editions the way that they did with 2011 and 2014 and 2015? In other words, even 2015 edition certified modules that contain no criteria that have been changed with Cures updates will need a 2015 Cures update certificate to continue being recognized after the 24-month deadline?
So that's a really good question. So the silver bullet in all of that is the D12 and D13 criteria. All right, so that guarantees that every 2015 edition Chapel listing has to be updated to 2015 Cures update distinction, because D12 and D13 sort of enter into the same realm right now that we have for G4 and G5, and that is every certified product has to be certified to G4 and G5. Now they're adding D12 and D13 to that list so even if you hypothetically had a certified product up there on the Chapel that was only certified to G4 and G5, right, it would still have to be at some point in the 24 months updated to include D12 and D13. So now, to be clear, there's not a new program like 2011, 2014, and 2015. It is an update to the existing program, but especially in this 24-month transition period, there is some distinctions between the two to help with, just transitioning everyone from what the program is like now to where it's going with the cures date. And so that includes, even ONC's website where they would publish their test procedures, their companion guides, test data, all of their, documentation like that. They're having to make a distinction between, the documents that cover the program now and what the criteria states now and versus what the new and the revised criteria for the cures update is. And the same as with the chapel, during this time, there'll be there'll be two, chapel distinctions and way to filter and view, the cures update chapel listings versus the 2015 ones. So in some ways, function kind of a little bit act like a new program, but it technically really isn't. But that D12 and D13 is the killer for everyone. That leaves no one spared.
All right. I have two questions that were very common. And number one is for the revised C3 CQMs, the requirement is, the date is April 30th, 2022. I believe there was a typo in the slides. The second one is for the revised B3, that requirement is also due April 30th, 2022, not 2023.
Right.
A question for C3, where can we find documentation regarding differences between the HL7 implementation guide and the CMS implementation guide?
I guess you're probably I guess the question is probably asking, is there some sort of gap between the two, some sort of document that does a gap analysis of them, or something to that effect. I'm not sure if such a document exists. Perhaps someone like MITRE, who is the author of the Cypress test tool that does all of the CQM testing, it's possible they might have some sort of crosswalk document like that sort of, but I don't know of one. But I'll tell you what, James, let's maybe make a note of that. I think that's a good resource to see if we can track down to see if it exists somewhere, and if it does, we could share with our customers. I would. So let's see if we can follow up on that one. It's a really good question.
Sure.
Other than just taking the two implementation guides and sort of, doing it yourself, I don't know if anyone else has sort of done that hard work yet.
Okay.
And we are at the top of the hour, so just if we have one more question to throw in there, and then we can wrap it up right then.
Sure. Really quickly, what are the specific ASTM changes that need to be addressed for D2 and D3?
Well, that's kind of a little bit of a loaded question. I think so there are new requirements in the new ASTM, and on our slide, we did pick out the sections out of that standard that you should focus in on and make sure that you're compliant to. So I don't know, maybe while I'm talking here, Heather can kind of rewind back to that slide on D2, D3, and D10. But one thing I'll just reiterate is, and I think what is one of the major takeaways here, is one of the new requirements that came out in the ASTM standard is this, and I know that Heather, went over this before, but I know things fly by quickly. There is a new requirement called duration of access. that is a requirement to be logged. And so I know that when ONC originally read this new ASTM requirement, you know, they had an interpretation of what that meant, and that was going to be something that was going to be required to implement from vendors. Now, you know, we've since talked to ONC about it, and you know, they've went back to the tool to the spec authors and sort of revisited that duration of access, and so, you know, their take on it now is that, you know, they might have misunderstood the initial intent from the authors of the standard about that. And we are expecting them to kind of clarify at some point in the future that, you know, that will be something that won't be applicable to ONC certification for the audit logging. But I would just take a look at those sections there that we have on the screen, mainly those sections in 7.1. And, you know, those are the ones that you should, you know, focus on in being, you know, compliant to. And I think after you read those and if you have questions about them, you know, feel free to hit up your account manager, your test proctor, and, you know, and get some further clarification. But I think we're out of time now, and I'll hand it back to Melissa just for her final words and closing down the webinar. But if your questions didn't get answered, we'll follow up with you and by email, and don't hesitate to reach out whenever you have more questions. Thank you.
Yeah, thanks so much. And I just wanted to see if Heather, if you could go back to that slide where the date was incorrect, just so that people still on the webinar can see it, and then we'll also correct them whenever you're able to download the slides.
I think we said B3, correct, James? Had a
Yeah.
typo for them. Yep.
B3, the revised B3 is April 30th, 2022. And the revised C3, CQM, is April 30th, 2022.
Perfect, thank you. And so I want to say thanks to everyone again, and we'll have another webinar on the new criteria next week, and then following that, the conditions of certification at the end of May. So let us know, and we'll send you the recording for this, as well as how to sign up for updates on our website. Thanks everyone, and we'll see you next week.